All right, let's see. Are we live? We are live. Hi there, Dr. Rapid Vet Triage. It's August 9th, 7:28 p.m. Pacific time. Late stream, but it was a busy day. So, yeah, it is what it is. We'll see if folks show up at this hour. Sometimes we get more people here than we do in the morning stream. But thanks for those watching the playback. And please subscribe and hit like and share, do all the things. So, unless folks come in with some questions, I'll go over some general questions that we get as veterinarians from pet owners. So, we'll just kind of, whatever comes to my mind, I'll just shoot and we'll see where it goes. Let's start with the first one. Do I have to get my pet vaccinated? The answer is sometimes for some situations. So veterinarians have guidelines that are released by I think the American Veterinary Medical Association. I'm not entirely sure, but it doesn't matter. Sometimes I think the internal medicine consensus statement comes out too with this information. But there's guidelines out there that veterinarians can follow, and they're supposed to be guidelines. Guidelines meaning not strict rules, not laws. They are applicable to whatever scenario. And so you use and not use them depending on the situation you're talking about. So not every pet needs every vaccine. That's the answer. You have to take into account the life stage of that pet and what the relative risk of that pet to contract that infectious disease, which is what vaccines are made for. They're made to prevent infectious disease, or if not prevent infection from them, at least mitigate the illness when you do get infected by it. And in some cases, decrease spread and of the infection as well. So when I say risk, I mean risk of getting that infection, not risk of the actual vaccination itself, of which it's minimal. But some pet owners that watch this will know that they've had pets in the past that get vaccine reactions pretty predictably, and others never have a problem with it. So your vet should be tailoring what vaccines your pet should receive based on those factors. And there are some vaccines that are considered, like optional depending on certain circumstances. So, for example, if you live in the Northeast, Lyme disease is a big concern. So the Lyme vaccine is pretty good. Getting the Lyme vaccine out west is not as useful. There aren't really that big of a problem with ticks here. Or if you live down south, heartworm prevention is mandatory because of all the mosquitoes and heartworm disease prevalence, but not so much in colder areas, for example. And heartworm is not a vaccine; it's a prophylactic treatment. But the point remains: you do it because your pet needs it, because they're at risk. If you don't have a dog that is jumping in the wilderness, in the rivers and creeks and whatever, interacting with wildlife, well, then distemper vaccine is maybe not required for you. So it just depends on the scenario. A lot of these vaccines are very, very good. Rabies vaccine is very good. Protecting against rabies. The parvovirus vaccine is very good. So they have really high protection. And legally, you have to have a rabies vaccine for dogs and cats. I don't know about other animals. And then in regards to puppies, you kind of want to get them vaccinated while the antibodies from the colostrum from the mom are dwindling as they get older. You want to vaccinate them. It'll help with their immunity. And then after a year of age, you can decide whether or not they should get vaccines of a certain kind. But even like Lyme vaccine, for example, not every puppy gets it, or Bordetella. Just depends on the scenario. So and then alternatively, you could consider vaccination titers. So if you're trying to not vaccinate your pet, you believe you don't need it, maybe legally you're just like, with the rabies vaccine, you're like, I don't want to do it. How do I get out of it? Well, you could have your vet grab blood work and submit the blood work for vaccine titers. If your pet is a protective titer concentration or whatever it is, value, great. Then you can prove your point. You don't need a vaccine. And some pets get such bad reactions from vaccines, it's just not worth it. Especially if they're like low risk. If you've got a lap dog who barely leaves the home, or they never leave the home, they're just like wee pad trained, then how big of a risk is it for them to get any disease that's infectious in nature if they're not interacting with other pets or with wildlife? So, all right, so that's a common question we get. Hopefully that helps. Let's see what other questions we get. I did not know there were specialists in the field. That's a common one. And yeah, we've got specialists. I have a few live streams on that if folks want to check it out. But the um, rise of specialists was not always there. It probably started maybe I don't know, 20, 24, 25 years ago, something like that. Probably started longer than that, but as far as when it took like a huge swing upwards, it became very popular and became more mainstream. Yeah, probably about a quarter of a century ago, and now it's common knowledge, at least in the veterinary communities, that there are specialists out there. Some situations are underutilized, sometimes they're overutilized, but regardless, yeah, we have specialists. You pick your poison. We've got surgery, radiology, dermatology, anesthesia, emergency, critical care, all the good stuff, cardiology, etc. And so it depends on what you need, and your vet will refer you if that's the case. But yeah, we do have specialists. We're not as specialized as human medicine. So if the surgeon, if the veterinarian is a surgeon, they don't specialize in like knee surgery or chest surgery. They may specialize in orthopedics or soft tissue or neurosurgery or a combination. But broadly speaking, every one of those three categories, they're going to do a bunch of surgeries, depending on their expertise, their experience, their training, what they're comfortable with. Blah, blah, blah. So so we're not as specialized. If you need hand surgery, you go to a hand surgeon. If you need foot surgery, you go to a foot surgeon. If you need chest surgery, you go to chest. If you need heart surgery, you go to a heart surgeon. So it just depends on what you need as a human. But in animals, not so much, not as specialized. They try to super specialize us. It never works out. There's just not enough of a traffic to keep that surgeon that busy. Whereas you're a hand surgeon, you probably are booked out. Let's see. Let's do one more. Comment. Oh, what should I? How do I know if a dog food is good for my dog? There's so many brands out there. What do I pick? And maybe finances are a concern. Maybe your ability to feed your dog or cat multiple times a day is not realistic, and whatever. So as far as like dog foods, there's lots of new companies now that are bragging about having human grade dog food. Cats get left behind, unfortunately. I imagine it'll probably catch up to cats, but they're a bit tough because they're obligate carnivores. So for those of you who are trying to make your cat vegan, don't. Bad idea, not good for them. They're obligate carnivores. They need 100% like protein in their diet. But anyway, whereas dogs are less so, but still no vegetarianism for your dog either. They are meat eaters. Okay. Anyway, so yeah, it depends on what people say about dog foods. If someone likes the dog food they use for their dog, they're proud of it. Great, they're posting it online. And then you see multiple reports like that. Sure, that's great. Does the company have research to back up their claims to the dog food? You want to have publications there. You may not necessarily need to read the publications, I guess, but do they have research to back up what they're saying with scientific data? So that's another thing to look at. Get your vet's recommendations because different life stages, different diseases for your pet, different goals determine whether and what food you feed your pet. So that all matters to consult with your veterinarian, of course. You can talk to vet triage veterinarians as well for dietary recommendations. And then there's also home cooked foods. You can go online and look up recipes and make sure you're hitting all the target nutrients for your customized food, your homemade food. You can do that as well. There's raw food diets, which very strong mixed opinions on that. I think it's fine for the most part, but it is specific to certain cases. There's a fear of higher bacterial load with raw, and because it's not cooked, and so some pets may be immunodeficient, like cancer patients undergoing chemo or radiation when their immune system is suppressed. They can't fight off infection that well. In fact, infection can be devastating, even like a really basic one. Where a normal healthy animal would have cleared that infection no problem. These animals can't. So those are all factors to consider as far as diets go. And key thing is to tailor it to your pet. And then of course is what you can afford. Expensive is not always better. It just depends. But having a big dog is more expensive than a smaller dog. They're going to eat more food on a monthly basis. And then if you have a dog that needs a prescription diet or a cat that needs a prescription diet, that's also pricey. You have to go to the vet every time to get a script, get it refilled, and so that is you're going to pay the price for it, but that's the thought process behind diets. So yeah, I think that's probably pretty good. 3 common questions we get. Thank you those who watch us on the playback. I'll see you guys again tomorrow, Saturday, August 10th. Should be an early live stream tomorrow, and hopefully folks join and ask all the questions and do all the things. So any suggestions for these live streams, please leave me a message and we'll, I'll look at it and we'll go. Thanks everybody. Take care. Bye.